question. This is a good question. One of the most interesting things about plastic surgery, which is what I love about it, is that, by the way, Dr. Maka, board certified plastic surgeon. I'm in Nashville. But one of the most neat things to me is that you can take 5 plastic surgeons in a room, present them with the patient, and they will all have a different way of getting to the ultimate goal. And none of the ways are wrong. It's just how they would approach it. There's multiple ways to solve the puzzle, if that makes sense. It's not wrong to do a breast lift first and then implants later. In fact, if I see a patient who maybe they have a severe degree of ptosis describes how far the breast hangs down. So if it hangs down really, really low and they want implants, I might recommend staging it in that situation because it is about safety. Many times, if you can delay it, in other words, if you could do the breast lift first, do the breast lift and do what it's called a delay procedure. In other words, what happens is, you make incisions for a breast lift, and now what happens is that remaining skin, that nipple, gets collateral or extra blood flow. Me, the majority of the time, like many of the situations I have where I do a breast lift and an implant all in the same setting, think about it as a patient, and honestly, their downtime. Most people are just wanting to do the surgery once and be done, and not like half surgery already planning on another one, right? So I feel like if I can safely do it all in once, and I have done that multiple times, safely do it all in one, get the breast lifted as much as we want, get the implant to fill out the space, then I'll do it. And so I've done breast reduction with implants. In other words, reducing a heavy breast to reduce tissue where we don't want it, but then add an implant where we do want it in the upper pole, right? So it's the addition subtraction concept is what that's called. But that's really why it's about blood flow. It's about safety. It's about being cautious. But I do feel like it can be safe in many cases to do them both together, and it limits downtime and things like that. Now, I will say this. In patients who have massive weight loss, right, that skin is so stretchy that you stretch it, it heals, and over time, that skin has a little bit of relapse because it kind of loses its spandex. So in patients like that, I will counsel them that, yes, you know what, we can do it in one. We can do the breast lift and implant together, but you have to be very well aware that you may have some relapse in the loose skin, relapse because of the loss of elasticity and collagen in the skin. And because of that, you have to be prepared that we may have to do a touch-up or revision, which potentially, could be done without anesthesia in the office, but just be aware of that, right? I always say that surgery is about improvement, but not chasing perfection, right? Because you just have to have a realistic goal in that sense. Okay, I hope that answers your question. Take care. God bless you.